On behalf of the Area Agency on Aging of Pasco Pinellas, I welcome you to Aging on the Suncoast. As we work as a nation to expand access to health care, it's particularly important that we protect the Medicare and Medicaid programs from fraudulent activities. Whether we are taxpayers or beneficiaries, health care fraud should concern all of us. On today's program, we will learn about the impact of fraud in the Medicare and Medicaid programs. Lieutenant Carol Conroy with the Office of the Attorney General's Medicaid Fraud Control Unit joins us to provide information about Florida Medicaid and the efforts of the Medicaid Fraud Control Unit. Also joining us is Makiba Huntington-Simons, the Program Manager of Florida's Senior Medicare Patrol Program. Welcome to Aging on the Suncoast. Thank you. Thank you both for taking time to be with us here today. Makiba, start by telling us you are the program manager for Florida, the whole state's Senior Medicare Patrol Program, which we call SMP.
Yes.
What is the mission of SMP?
The mission of SMP is to empower seniors, caregivers, professionals on how to avoid Medicare and Medicaid fraud and abuse. And we do that in a number of ways. So we help educate folks out there in the community through outreach events, through group presentations, and things like that.
Okay, and Carol, you have been working with Makiba as part of the Medicaid Fraud Control Unit. Tell us what the role of that unit is.
The Medicaid Fraud Control Unit is a statewide law enforcement agency within the Office of the Attorney General, and we do the provider fraud, as well as patient abuse, neglect, and exploitation of folks that may be in facilities within the state of Florida. And we work often with Makiba on outreach presentations of accepting referrals from SMP for our follow-up investigations.
Okay, so we're really looking at fraud from every aspect today, from the point of prevention, which is the most important. We never want it to have to come to the attention of the Fraud Control Unit, through the process of reporting and investigating and, of course, prosecuting those who have engaged in fraudulent activity. Yes. But let's start by discussing how large is the Medicaid program in the state of Florida?
Presently, there's almost 3.5 million recipients that have Medicaid within the state of Florida. The budget for the state of Florida is approximately $23 billion for Medicaid at the present time for this fiscal year.
And before the show, we were talking about a major transition that has occurred in the Medicaid program this last year with the move to Medicaid managed care. Can you give us a summary of that? I'm sure it's a very complicated new program.
Yes, the recipients, approximately 90% of all Medicaid recipients in the state of Florida will be required to go into managed care. Approximately 10% will stay under fee-for-service, and a small percentage of the waiver programs. The state believes that it is more of a predictive model as to the amount of money that would be spent because there's a capitation payment paid to the various health management organizations, and versus fee-for-service, where you really wouldn't know from day to day or year to year how much money is going to be spent depending on patient care, where with the capitation payments that go into the various programs and plans, they get paid a monthly stipend per recipient, and they take on the responsibility of providing all the care under those plans.
So this is one step the state is taking in terms of controlling Medicaid costs for such a large program. But one of the other steps that has been taken in the state of Florida and nationally with our Medicare program also is to control the fraudulent activity, to make sure that the dollars that go into these programs are spent for delivery of service and not skimmed off through scams or other activities. I know that you had shared with me that in the last fiscal year, the Medicaid Fraud Control Unit had recovered over $18 million in funds that had been
$182 million.
$182 million.
In the last fiscal year, between both civil recoveries as well as criminal restitution. We have a unit within our unit that does national settlements with large corporations, and so between what we call the Civil Enforcement Bureau, getting large recoveries back through civil settlements, as well as our criminal restitution, it's been $182 million in this last fiscal year. In fact, for the last 5 years, it's been almost $800 million that the Florida Medicaid Fraud Control Unit has been able to recover for the program.
So a tremendous amount of savings there. Can you put a face on this for us, Carol? You know, obviously I couldn't wrap my head around the number. I had said 18 million instead of 182 million. What do those cases look like? What are we talking about? What's occurring in the community that precipitates this fraud?
Well, in the national cases, many times it would be a large pharmaceutical company who would be doing off-label marketing. One particular pharmaceutical company did possible adulteration of medications, and that was, you know, found out. On the criminal side, we recently had some targeted case management providers that probably almost $2 million worth of fraud have occurred with that type of provider within the last year and a half that we have uncovered. We've made some arrests, we've executed search warrants, forfeited vehicles and you know, high price items that the folks go out and buy as a result of obtaining money fraudulently from us.
Now, when you talk about case managers and fraudulent activity, are you talking about billing for services that weren't rendered, or what's actually transpiring there that is fraudulent?
Yes, billing for services not rendered, upcoding, not meeting the criteria of what the service is that they're supposed to be rendering to the Medicaid recipients. So it's a variety of items across the board when it comes to all the criminal activity, yes.
Are there particular types of health care that are where fraud is more prevalent?
Well, areas that we do look at, of course, would be physicians, home health care. You know, that's a very large item these days that we do try to keep recipients in their home as much as possible. And as a result of that, more services are provided within the home. But you really want to make sure that the amount of services that are being paid are actually being rendered.
Right.
So that's where you can have upcoding and, of course, billing for services not rendered.
Of course, we always have to mention that so much of the medical and healthcare delivery system is provided by people with very good reputation,
Yes.
and provided in the way and billed correctly, that it is only oftentimes a small group that is misusing the system that brings about this type of activity. What should recipients be aware of? And perhaps, Makiba, you can speak to this because you're out there educating recipients. They have a responsibility here, that if there is some irregularity, that to report, to keep on track of what's being billed. Give us some tips about how to do that.
Well, one of the tips that we give folks about taking control and protecting their health care is not to share any of their health care information with strangers who may want to abscond with their recipient numbers or their medical information. Make sure that they, when they're offering something that is free, that they do not give them a peek at their cards or their medical information. Those kinds of things. We want people to empower themselves and to ask questions, and ask questions of doctors if there is something that doesn't sound right or their lab work that they're requiring that's unnecessary. So we want them to use their mouths and question things.
Okay. Carol, are you seeing some other areas in which prevention can occur so that it never arrives on your desk?
Well, surely, as Makiba suggests, to protect your information is really a paramount thing. It's basically on the Medicaid side, those cards that the recipient has is basically, if you want to think about it, as a credit card.
Okay.
And once a provider has that number, they can bill. Oftentimes, and you know, if it's for services not rendered again or upcoding, you really need to protect your information so that it's not out there for people to take advantage of. And once services have been rendered, we do send out explanation of medical benefits, and we really ask people to please review those, make sure what's listed on them are the services they actually did render. If they could almost keep a little calendar of when they do go to various providers, so that if we had to come out and ask you, you know, did you see Dr. Smith on this date, they might be able to tell us, yes, I did, or no, I didn't. So those are all ways that they can help us to do more what we call cost avoidance to the program.
And in the S&P program, we do offer personal health care journals, as Carol mentioned. It's important to document all of their visits and prescription drugs and things like that. And it's open to your audience. If they want to contact us, we'll be happy to send them a personal health care journal so that they can, as Carol mentioned, compare it to their explanation of benefits. So.
And during the program, we will be running the telephone number for the S&P hotline.
Great.
That's the number that they would call.
Yes.
But that's also the number to call. You can get your personal health care journal. But if you suspect any irregularity on your Medicaid or Medicare account,
we have a dedicated fraud hotline. There is someone there Monday through Friday, 8:30 to 5. We usually return calls if there's no one there between 24 and 48 hours. So people can call and report fraud if they look at their EOB and compare it to their personal health care journal. They can, and they suspect some fraud, they can call us. They can definitely call us. We're there to help.
And actually, the staff person who answers the hotline is bilingual in English and Spanish.
English and Spanish, yes.
Any person in either of those languages can call and start a report. And what happens after they make the report?
Well, after they make the report, we'll send them some information so that they can release their information to us, including their MSN or their Medicare, their Medicare number or their Medicaid number. And then we do sort of, I guess you call it a desktop investigation of the issue. We'll contact the provider if necessary, and then we'll send it on to our partners at the Medicaid Fraud Control Unit or the Office of the Inspector General for them to handle it and take it a little further than we can.
And Carol, when it comes to your office, what happens from there?
Well, we can get our complaints through McKeeba, through SMP, or we can get them. We have our own website on myfloridalegal.com, where there is a complaint form there that you can fill out online, or 866-966-7226 is the phone number that someone can call. It's the Citizens Hotline that there is somebody there 7 days a week to take the information.
We're running that number too.
Thank you. And brand new, we actually have just had the opportunity to get out onto the Apple iTunes store. And if someone would type in their search engine there, Florida Office of the Attorney General, there's a free app out there that similarly they can file a complaint right through their mobile device, whether it be an iPhone or an iPad. We are working on the Android version of it, but at least for right now, it can be done through the iPhone or iPad. So we're looking forward to getting information through that variety also.
That's awesome.
You're making it as easy as possible.
Absolutely, yes.
And once you get this information, then, Carol, how does the Medicaid Fraud Control Unit work with it?
Well, we open up a complaint. Every complaint that comes into us, we are going to take, we won't say a desk audit of it, but we're going to take a preliminary review of it and look at the billing and what's surrounding that. And once we do the preliminary, if we do find that there's more information there that we need to do, we'll open up a full-blown investigation on it and work it as a criminal investigation and see it through its fruition, either as a criminal case or ultimately we may do a civil settlement with a provider if we can't get it to the level of actual criminal activity.
Excellent, excellent. Thank you both for sharing with us this important information. And Carol, I wish you the best in the important work that you do. It's good to see, how the process starts and where it ends up. We've been talking during this segment specifically about Medicaid fraud, and during the second segment we will be talking more about Medicare fraud. Again, SMP is involved in that, so I hope our viewers will return to hear us talk about Medicare fraud in our second segment.
Look, here's a charge for something we didn't order.
Good catch.
I don't think you should ever pay for any bill unless you have first made sure that all the charges are correct.
Speaking of which, have you heard of the latest Medicare scams? This happened to my friend. A man came to her door claiming he was from Medicare. He had a smooth line about helping seniors with the high cost of their medicines, but she had to give him her Medicare number right then before the deadline. Well, when she got her Medicare summary notice, it was full of charges for services she hadn't received. Turns out this guy was a scam artist.
Medicare already has everyone's number. They wouldn't need to ask for it.
Scams like these hurt every taxpayer, draining billions from Medicare and making it harder for people like us to get the health benefits we're entitled to. So I did something about it. I joined the Senior Medicare Patrol, where I work with other volunteers to teach my neighbors how to protect their Medicare numbers, review statements to spot false charges and detect errors, and report suspected fraud.
Today we are talking about healthcare fraud. During the first segment, we focused on Medicare fraud, but now we turn our attention to Medicare fraud. I'm pleased to welcome Special Agent Raquel Garrido, who serves with the Department of Health and Human Services Office of the Inspector General. And returning for the segment is Makiba Huntington-Simons, who is the SMP Program Manager for the state of Florida. Thank you for joining us.
Thank you.
Raquel, please share with us what the role is of the Office of the Inspector General in terms of healthcare fraud.
HHS-OIG essentially ensures the integrity of the HHS programs, which include Medicare and Medicaid.
Okay. And I understand that over the last 5 fiscal years that Health and Human Services investigations nationally have recovered over $18.2 billion in fraud cases. Can you share with us some examples of those cases?
Well, one recent example that is specific to the Central Florida area would be a hospice case that in which we recovered approximately $3 million. And this particular case, the hospice was enrolling for services members that did not quite qualify and was collecting funds that were not due to them.
Okay. And what happens to the money that is recovered when you do, when there is prosecution and recovery of monies? Does that restore to Medicare and Medicaid?
That's correct. Whatever monies we recovered go back to the affected program.
What are some of the common scams or fraudulent activities that have occurred in recent years?
The traditional ones are the most common ones: billing for services not rendered, duplicate billing, unnecessary medical services. More recent, a new trend has been medical identity theft.
And what is medical identity theft?
Well, basically the theft of Medicare or Medicaid numbers, which are later used by a provider to bill for a particular beneficiary, or by just a random individual posing as that beneficiary to steal services for themselves.
Okay. Which goes back to your caution on the first segment, Makiba, of saying protect your Medicare and Medicaid cards just as though they were credit cards, because that can open up to fraudulent activity on those accounts.
Yes.
Are there other scams that you're seeing?
Well, we've gotten a couple of calls about patient recruiting, I guess you could call it, where people who are living in low-income housing facilities are being asked to, get in collusion with some folks who are going around asking them to go to mental health facilities and things like that. And basically they're going there just for social situations. There is no mental health help for them there. It's just basically to get their Medicare number and to build the Medicare program. And there are kickbacks for the folks who participate in it. So,
when we we've been talking about the financial impact on Medicare and Medicaid when this occurs, but there also can be an impact for the person if their number has been used incorrectly. Do you sometimes have people calling that they've had problems with getting services because of this?
Yes, we did. We had a call maybe about a year ago. A gentleman's daughter called us and said that her father was not able to get a wheelchair. And she couldn't understand why, and what it was is that his number had been compromised, and someone else had a wheelchair on his behalf, I guess, and was using the wheelchair. And we were able to get the wheelchair eventually after contacting the Medicare program.
Okay, so
Yes.
when something got billed to
Yes.
the improper account, there was a repercussion.
It absolutely
for
affects
that.
the health care of people.
Okay.
And not to mention, it's the Medicare number is their Social Security number. And not only can they bill the Medicare program, but they can commit identity theft. And I understand it's a very arduous process in getting your life back after you've been a victim of identity theft. So.
What are some of the red flags that should alert someone that there are problems on their Medicare account? We've mentioned this when you are trying to get a service and you are denied that service, being told that you already have a wheelchair.
Yes.
But what are some of the other things that alert someone that there has been some fraudulent activity?
Well, first, you should absolutely read your Medicare summary notices when they come in. Make sure you compare it to your personal health care journal. Make sure that the services were rendered on that date. Make sure that you know who that doctor was and compare it to the name of the doctor. If it's a new doctor, you may want to compare the names on your personal health care journal. You want to make sure that the services were rendered. You want to make sure that they aren't billing you twice for the same service. And you want to make sure that the service was prescribed by your doctor. There may be some coding on there that you don't recognize, and some basically that you want to call your doctor and say, well, what is this lab work? I didn't have lab work done, and you want to get to the bottom of it.
Okay. And the SMP program can help the person sort out whether, because sometimes I know when you, especially if you've had a surgery, you're going to get a radiology bill and a pathology bill and an anesthesiology bill. These are people that you may never have spoken to, but they're very legitimate bills. So you can help them sort out what is legitimate and what needs to be reported for investigation.
Absolutely, yeah. And there are a number of errors that could occur. So we just have to get to the bottom of it, basically, because it may just be an error or it may be fraud. You just have to look into it.
And when a person makes a report, whether it's through SMP or directly to the Health and Human Services, and we'll be running both of those numbers again during this segment of the show, Raquel, what happens when that comes to your agency?
When a report initially comes into our agency, whether it's through the SMP or our own particular hotline, we basically conduct an evaluation to make a determination where this particular complaint fits, if it's a criminal matter, a civil matter, or an administrative matter, and it gets funneled in that direction as appropriate.
Okay, and if you determine in order to make that determination, do you sometimes have to look at a number of reports? If I have a question about one particular, something that seemed irregular, and perhaps when you look at it you feel it's irregular, that may not be sufficient to act upon?
Correct.
You're looking for a pattern?
Right, and in that evaluation process, we engaged in a little bit of a mini investigation where we look at a claims data. If it's one particular beneficiary concerned about a billing pattern or one bill they have received or something they saw in their explanation of benefit, we review that claims data. We go over it with the beneficiary. We reach out to the provider in some instances and ask further questions as to why that was billed and how. And sometimes we end up clarifying. Sometimes it may have been a misunderstanding. Other times it's a more serious matter that warrants further investigation.
If I have made a report or my mother has made a report, what can she expect? What type of feedback can she expect? If, is she going to get a call in a month that says, we were able to prosecute this person, or is there...
Oftentimes, she's laughing, but oftentimes they may not hear from us. Then once we've sent the case on to our partners, it's in their hands, and it may become part of a larger investigation, and the beneficiary just may not hear from us. Yeah. But that doesn't mean that there isn't anything going on with it.
Well, and that does not decrease the importance of making the report.
Exactly.
Absolutely not.
These reports need to contribute to a larger picture, I would assume.
Right, and there might be some dialogue where the agent at HHS or whoever has been tasked with that particular complaint will engage with the complainant. I chuckled because it's not likely to hear back about a prosecution within a month. It takes a little longer than that. Sometimes these cases go on for several months, in instances well over a year. I've had cases that have lasted 2-3 years already. But to the extent that the agent is able to share information with the complainant, and depending on how frequently they stay in contact, some communication back and forth will take place. It's just that it's important for those complainants to understand that for the sake of, and the integrity of that investigation, not all information available to us will be released, even if they have submitted a complaint.
Okay. Can you share with us some of the other types of cases that have been pursued, particularly in Florida?
At this time, I believe that we're looking a little bit more into managed care cases. We've had a concern in the area with enrollment, fraudulent enrollment into certain managed care programs. And it's essentially a way for some healthcare organizations to obtain more capitation payments from programs such as Medicare, while not providing the additional services that they're promising to make available to these beneficiaries. So we are looking a little bit more now into the managed care organizations as well as enrollment fraud.
Makiba, I know that you are tasked with the responsibility to educate both Medicare and Medicare beneficiaries and Medicaid recipients throughout the state of Florida. And I know that you have very few staff persons, that you rely on volunteers.
So how do we do all of this?
How do you do all of this? If you could share with the audience briefly the role of volunteers in the SMP program, that they can be active in this fight against healthcare fraud.
Absolutely. We are a primarily volunteer-based program. Much of the work that we do here in Florida is done through our volunteers throughout the state. We recruit and train professionals, seniors, caregivers, anyone who wants to help us in Medicare fraud. And we train them, and we send them out into their community to talk to their church members or their social groups about Medicare and Medicaid fraud and abuse and how to avoid it, what to look for on their Medicare summary notices or EOBs, explanation of benefits.
And so they are doing presentations in the community.
Yes.
I know that I've seen them at a number of health fairs.
Yes.
They're getting the word out.
They are getting the word out.
And you have some excellent publications if our audience is interested in receiving both the Healthcare Journal,
Yes.
which will allow them to record their healthcare visits and
Yes.
keep those organized. But also if they want to inform some of these publications, you can get them out to them.
Or a volunteer application, because we're always looking for volunteers.
Excellent, excellent. I know that we all have a frustration about the rising cost of health care. And as we started the show talking about trying to expand the access to health care to more and more people, all of us have a greater responsibility about the proper use of that money.
Yes.
And we applaud the efforts, the tedious efforts of your office to work with those reports of fraud, but particularly the efforts of your volunteers. And what is it that you are looking for in a volunteer when, if I'm sitting at home thinking, I might be interested in this, what do I have to have special qualifications to do that?
No, you just have to have a passion for change and change in the health care and the Medicare programs and Medicaid. You have to want to keep the Medicare and Medicaid programs around and keep them viable for future generations. We want people who are energetic, people who do not mind being in social situations with other seniors, caregivers, etc. So come one, come all.
So we can be part of the solution.
Absolutely.
We've identified the problem. And I thank you both for joining us today and wish you the best in the important work that you do.
Thank you.
And for our audience, I thank you for joining us for this important discussion about healthcare fraud.